Hello, I'm Dr. Cantrell. Today we're discussing your upcoming surgery, which is a knee arthroscopy with medial patellofemoral ligament reconstruction. This surgery is performed for recurrent patella dislocations. First, I'll remind you to review your surgery packet. This packet has lots of helpful information as well as instructions. The surgery is an outpatient surgery, which means you can go home the same day. Some of the work is done through the arthroscope, which means it's done through 2 small incisions. However, we must harvest and then place a graft to reconstruct that ligament. The harvest incision is typically 1 inch or shorter in length, and the graft placement incision is typically 3 inches or shorter in length. After I perform the arthroscopy, which will include evaluating and treating other problems such as torn meniscus or scuffed articular cartilage, I will reconstruct the ligament. The surgery itself takes approximately 1 hour. After surgery, in the operating room, you'll be placed in a brace that keeps your knee straight. This will help you get around without feeling like your knee will buckle or come out from under you. You'll start physical therapy approximately 2 days post-operative, and that physical therapy typically lasts about 12 weeks post-operative. If your goal is return to sports, then at 12 weeks post-operative, you'll likely start working with a strength and speed coach with the goal of return to sports at approximately 4.5 months to 6 months post-operative. To help evaluate your readiness for return to play, you'll perform a Cybex test at 3 months post-operative and then at 4.5 months or 6 months post-operative, depending on your progress. That Cybex test is a strength test. On the date of surgery, you'll arrive at the facility at the appointed time. You'll check in at the front desk and likely fill out some paperwork. From there, you'll head to the preoperative area where nurses will take a history, check your vitals, and establish an IV. You'll also see me in the preoperative area. Additionally, you'll see an anesthesiologist. Typically, general anesthesia is used for this surgery. However, the anesthesiologist may offer you a block in addition to the general anesthesia. The block makes your knee numb for 12 or more hours post-operatively. If you're offered a block, I suggest you accept it. From the operating room, you'll go to the recovery room, and from there to the discharge area. In the discharge area, you and your family will be given instructions for home, as well as a prescription for pain medicine and for nausea medicine. Once you're home, I recommend you elevate and ice your extremity as much as possible. It's okay to get up and move around in the first several days. However, before you start physical therapy, just touch your toe down when you're getting around with your crutches. Once you start therapy, your therapist will teach you how to start putting full weight on your extremity. Pumping your ankle back and forth several times an hour is helpful for the first few days. That keeps your blood flowing, helps keep you from getting a blood clot. Additionally, you should work on straightening your knee as much as possible, as quickly as possible, with the goal of returning to full straightening, symmetric with your other side, as quickly as possible. You should keep your incisions dry until you and I meet back in the office. At 2 to 3 days post-operatively, you can take off the bandage, place waterproof band-aids, and get in the shower. After you shower, take those waterproof band-aids off, let your incisions dry thoroughly, and then you can just use regular band-aids or a light bandage as needed. I look forward to seeing you at your post-operative appointment.